My guest today is Dr. Skyellen Beaber, a clinical psychologist who's going to give us advice about how to handle the anxiety and stress related to the COVID-19 pandemic, along with some relationship issues. It's been a long grind. It's been a very stressful time, and I think we could all use a little bit of professional advice. So Dr. Beaber has a PhD in clinical psychology and practices in the Bay Area. She sees both individuals and couples. She specializes in anxiety and relationship problems, along with a lot of other specific issues, and uses many modalities, including cognitive behavioral therapy and acceptance and commitment therapy, and also has special credentialing in mindfulness and compassion in psychotherapy. Thank you, Dr. Beaber, for agreeing to come on to the show.
You're very welcome.
And I should also mention that Dr. Beaber is my sister and the author of the foreword of my book, Resilience in the Face of Multiple Sclerosis, which is about amazing people who live incredible lives in the face of adversity, and a little bit about the science and psychology of resilience. And I'm happy to give you a free copy if you'd like. You just have to have a way to send you a private message. So if you have a Twitter or Reddit handle, go ahead and post in the comments below, and I'll send you a link. So anyways, Dr. Beaber, what kind of mental health issues are you seeing, are people experiencing being exacerbated by the pandemic?
Well, right now, a lot of people are experiencing anxiety, understandably. We're living in the midst of a global pandemic, something that's unprecedented. People feel very anxious about getting sick, having their loved ones get sick. People's relationship to their employment is changing. Some people have lost their jobs or their hours have been cut. So they're experiencing financial anxiety. And people are feeling lonely, isolated, depressed. They're cut off from the people they're used to spending their time with, their extended social circle, and they're no longer able to access a lot of the hobbies and pleasurable activities they used to enjoy.
I'm definitely encountering that in my own practice. Now, I would argue a little bit of anxiety is completely normal. Maybe people aren't being anxious enough and not really following the public health guidelines, but sometimes it can be a little bit overwhelming. Let's start with one issue at a time. What can we do if the anxiety is just too much?
Well, of course, if your anxiety is impacting your daily functioning, then it's a good time to reach out and start therapy. And right now, you can start therapy in your own home. All therapists pretty much are offering video now, telehealth, and so it's very easy and accessible to get professional help. So that's one step, of course. There are other things you can do to help anxiety, such as making sure you're getting regular exercise, adopting a meditation practice, limiting things like caffeine, and doing other things that are soothing. And for some people, that can be a yoga practice, that could be baking, anything that you find soothing or calming.
Okay, so that's a nice segue into what I was going to ask you about mindfulness meditation. I know you're a huge proponent of that. To those who aren't so familiar with it, what exactly is mindfulness and how would you kind of start a mindfulness meditation practice?
Mm-hmm. Mindfulness is about paying attention to the present moment. So often we are thinking about the future, ruminating about the past in our heads. Mindfulness is about coming in to what's happening in the present moment right now. A very simple way to get started is simply to bring your attention to your breath. So for example, whatever you're doing, you can pause, you can bring your attention to the next in-breath, the next out-breath, simply observing the breath, being aware when you're breathing in, awareness when you're breathing out, simple awareness of your present experience. Now, of course, if you want to get more into a formal practice of meditation, you can do longer sitting meditations. There are many apps these days that will guide you through a meditation practice, and there are many, many types of mindfulness.
And if anyone's interested in doing guided meditations, I'll put in some links below to the websites of Tara Brock and Kristen Neff, who have some excellent guided meditations if you want to check that out. I think it's the kind of thing where this is good advice, but it's very difficult to start. And sometimes if you have something that's just pushed onto you, it helps a little bit.
Exactly.
Now, you mentioned something else, which is loneliness. Even if you don't have a specific diagnosis or mental health problem, this is a really difficult way to live, to follow the social distancing recommendations, to not see your friends, to not see your family, to be very lonely and isolated. Do you have any tips about how to sort of enjoy life despite everything that's going on?
Mm-hmm. Loneliness and isolation is a hard one, and everybody's access to connection is a little bit different. So of course, right now, people are connecting online. You can have a book club over video. I've seen people do really creative things like even bake a recipe together. Everybody bakes it at the same time over video, watch a movie and discuss it. So there are a lot of ways to connect online, but sometimes that doesn't feel like enough. There's something very special about in-person connection. And so if there are ways to safely outdoors sit, 6 or more feet apart away and be able to spend some time with a close friend, that's a nice way to get some connection if it's accessible to you.
And certainly relatively safe to do that. I mean, we think that masks are effective, and if you stay far away, the droplets don't spread all that far. Now, I know you talked about people kind of think that therapy isn't available because people don't want to go into appointments, but I know you're doing exclusively telehealth. What is that like? What are the advantages of that? What are the disadvantages of that?
Mm-hmm. Right. It's been new for all of us to shift our practices very suddenly with very little warning to telehealth. Some of the advantage of that, of course, is convenience. People aren't leaving their houses. They don't have to commute. It takes 2 seconds to walk over your computer and log on. One advantage is that as a therapist, for the first time, you see people in their actual living environments. You might see their pets. You see what's in the rooms around them. You get a fuller sense of what a person's life looks like. Disadvantages, there's something about the boundaries of therapy. When you go to your appointment, you have that time on your way in the car to think about what you're going to say. When you enter the waiting room, you start to prepare yourself for the session. You transition from your outside world more into internal reflection as you get ready for the session. The session is separate from the rest of your life. And then you have the time to transition back. There are no transitions like that anymore. People are, darting off a work call and jumping onto a therapy call. They don't have the same space and sacred space to make that transition. People are still sometimes partially in work mode when they log on.
That makes a lot of sense. I didn't think about that, but it's kind of a unique thing to go to therapy and you're thinking, okay, it's time for therapy. I'm going to be in that mindset, that learning and changing mindset. I hadn't thought about that before.
Mm-hmm.
Now, the other thing go ahead, please.
I was just going to mention that a lot of people are in living environments that are loud. Their children are in the next room. They're worried their partner can hear them in the next room over. People don't have the same feeling of privacy. And I've encouraged people to get sound machines or white noise machines, but people feel freer to talk openly in your office, which is, as I said, apart from the rest of their day-to-day lives and worlds. It's hard to complain about your partner when your partner's in the next room and you think they might be able to hear you.
Right. Now, speaking of partners, people are spending a lot more time with their partners, or in some cases, less time with their partners. But obviously, the pandemic is putting a lot of stress on people, making people have conflicts where they have to compromise. What kind of issues are people having in terms of relationships?
Mm-hmm. There are a few. The biggest one I'm hearing about lately is childcare with kids not going back to school. Parents, when both people perhaps work full time and are working from home and now have kids who are starting school remotely, are really struggling to figure out how to do that. And they really have to work as a team and collaborate. This is new for most parents who are used to having the separation again from work and family life.
The other thing I could think of is that I'd imagine, there's no exact specific recommendations to do everything. Is it okay to send your children to school if you're in an area where COVID-19 is relatively controlled, for instance? You have to wipe down the groceries. And I'm sure in a couple, some people are going to be more vigilant and some people are going to be a little bit more lax. How do you resolve those sorts of disagreements?
Mm-hmm. Sometimes people are not on the same page. I haven't encountered that actually as much. Most of the people I've encountered are on the same page as their partners in terms of safety precautions. But one of the things that comes up a lot for people is space. In your day-to-day life, you go to work, you go see your friends, you have hobbies and interests, and then you come back home and share your experiences with your partner or partners. But now partners are together 24 hours a day. They're not having different and separate experiences to come home and share with each other. And that is part of the joy of a relationship. They're spending a lot of time together. I've talked with couples about ways to take space. Sometimes someone just would love to have the house to themselves for a few hours. These days, that's really a luxury, and it's not always possible.
And so that's sort of advice you give to people, try to create some alone time for each person in the couple.
To create some alone time, even if it's one person going to a park for a few hours to read a book, or someone taking the kids so the other person can have some just real quiet downtime. But couples need space.
This is all extremely helpful. Do you have any other general advice that I haven't asked you about?
Right now,
go ahead.
Right now, it's important to find small moments of joy, taking pleasure in the little things that we used to take for granted. So whether that is listening to some music, feeling the power of that on our mood, watching a movie, taking a beautiful walk in nature, baking something and smelling the delicious smells. These are small pleasures that we can drink into our nervous systems when there's so much stress that we're being inundated with. Taking breaks from social media, this is something that comes up a lot. People feel inundated with Facebook, the news, and Twitter. Taking time to put your phone on airplane mode, deciding you're only going to check the news once a day for 15 minutes, making sure that you're not constantly flooded with anxiety and panic, right? If you're going to spend an hour watching a news, maybe spend an hour listening to classical music, something to calm the nervous system and give yourself some other input.
I think we could all use a little bit of a break from the news and a little bit of the simple pleasures that you were talking about, for sure. Well, I really appreciate you coming on and doing the interview. If anyone has any questions for Dr. Beaber, go ahead and post them in the comments below. I'll relay them to her and answer on her behalf. And if you have any other suggestions for future videos, please post in the comments below.